Hello and welcome to this infection basics video. I'm Dr. Aled Roberts, and in this video we're going to look at the chain of infection, so how infectious agents spread from pathogen source to susceptible host. Now this is part 2 of the video where we'll focus on the transmission of infectious agents and look at host susceptibility. Now, one of the most important parts of the chain of infection, and arguably one that we can control the most, is the mode of transmission. Essentially, this is the bit that bridges the portal of exit from our reservoir with the portal of entry on the new host. Put simply, this is how an infectious agent physically moves between hosts. Now, this movement can be directly from one host to the next, or it can be indirectly via an object which both hosts interact with at some point. Now, there are several modes of transmission. One of the more common modes is contact, and this is where someone directly touches something that is contaminated with an infectious agent. It could be someone else's hand through a handshake, it could be from a door handle, and I guess a key example of this transmission would be norovirus. Next, we have droplet transmission, which involves short-range respiratory spread, and so this occurs when people cough, sneeze or talk, and droplets containing the infectious agent are released, and they typically travel short distances, so around 1 to 2 meters. Now, pathogens transmitted this way include things like the influenza virus and SARS coronavirus 2, as well as bacteria such as Neisseria meningitidis. Now, closely related to this, but with key differences, is airborne transmission. Now, this involves long-range respiratory spread, so typically more than 2 meters, and that is because infectious particles remain suspended in the air for longer periods of time, allowing them to travel greater distances, and so classic examples here include things like Mycobacterium tuberculosis, the measles virus, and the varicella zoster virus. Now, before we move on, it is worth mentioning the nuanced difference between droplet and airborne transmission. In essence, it largely comes down to particle size. So droplet transmission involves particles larger than 5 micrometers, which are relatively heavy and do not stay airborne for prolonged periods of time. Then on the flip side, airborne transmission involves particles smaller than 5 micrometers, which are lighter, remain airborne for much longer, and therefore travel further distances. Okay, so our next mode of transmission is vehicle transmission, where infectious agents are spread through a contaminated, inanimate object that is typically ingested. And so this includes things like food, such as undercooked chicken contaminated with Salmonella species, dirty water contaminated with Vibrio cholerae. We can even consider contaminated blood products and the transfer of the hepatitis C virus as a form of vehicle transmission. Next, we have vector transmission, where the infectious agent is transported by a living carrier, usually an arthropod of some kind, and so mosquitoes transmit Plasmodium species that cause malaria, fleas can transmit Yersinia pestis, the causative agent of bubonic plague, and ticks are responsible for spreading Borrelia burgdorferi, the causative agent of Lyme disease. And finally, we have vertical transmission, where the infectious agent is passed directly from mother to baby, most commonly across the placenta during pregnancy. And so things like Treponema pallidum can be transmitted across the placenta, causing congenital syphilis. Toxoplasma gondii may cross the placenta, leading to congenital toxoplasmosis, and viruses such as the rubella virus or cytomegalovirus can be transmitted in utero, leading to developmental complications. And so together, these modes of transmission explain how infectious agents bridge the gap between hosts. Now, alongside these specific examples, we can also group modes of transmission more broadly as direct or indirect. And so direct transmission occurs when an infectious agent is passed immediately from one person to another with no intermediary involved, such as through physical contact or exposure to respiratory droplets at close range. Indirect transmission, on the other hand, involves an intermediate step where the pathogen is transferred via the air, contaminated surfaces, or objects such as a door handle, food, or a living vector. And so the key difference between the two is whether the pathogen moves straight between people or whether something else carries it along the way. And once again, we need to be thinking about how we can break the chain of infection at this stage. And so we need to be thinking about things like best practice, particularly in high-risk settings. And so a good example of this is food safety, where if we follow established guidelines for food handling, preparation and storage, this will help prevent pathogens from being transferred via contaminated food. And this includes measures such as avoiding cross-contamination, cooking food thoroughly, and maintaining appropriate storage temperatures. Now, another major control measure is the use of personal protective equipment or PPE, which acts as a physical barrier preventing infectious agents from being transferred between individuals. Now, depending on the mode of transmission, this may include the use of gloves, masks, eye protection, or gowns, and when used correctly, PPE is particularly effective at interrupting contact, droplet, and airborne transmission. Next, good hygiene practices are also essential for breaking the chain at the transmission stage, especially in public settings. This includes effective hand hygiene after contact with potentially contaminated surfaces, bodily fluids, or infected individuals. And so regular hand washing and appropriate use of hand sanitizer reduce the risk of transferring pathogens from one surface or host to another. And finally, we have decontamination, which plays a crucial role in limiting indirect transmission. So the cleaning and disinfecting of surfaces, equipment, and shared spaces helps remove or inactivate infectious agents before they can be passed on. And this is especially important in healthcare, laboratory, and communal environments where multiple people may come into contact with the same surfaces or materials. And so by applying these measures, we reduce the likelihood that infectious agents can successfully move between hosts, effectively breaking the chain of infection at the mode of transmission stage. Now, following on from transmission, we reach the portal of entry. This is the route by which an infectious agent enters a new host. Now, exactly how this happens depends on the mode of transmission involved. Now, one of the most common portals of entry is the respiratory tract, including the mouth, nose, and lungs, and infection can occur following the inhalation of aerosolized droplets or airborne particles. Now, pathogens that commonly enter this way include things like the rhinoviruses, influenza virus, SARS coronavirus 2, and bacteria such as Mycobacterium tuberculosis. Another key portal of entry is the urogenital tract involving the vagina or penis. Now, infection here typically occurs through direct sexual contact or exposure to contaminated bodily fluids, and examples include things like chlamydia trachomatis, Neisseria gonorrhea, the human papillomavirus, and HIV. Next, we have the gastrointestinal tract, which extends from the mouth all the way through to the colon and is another major portal of entry. Infection usually occurs through ingestion of contaminated food or water and is closely linked to fecal-oral transmission. Common examples here would include something like Salmonella typhimurium, Vibrio cholerae, and norovirus. Next, we have the skin, which normally acts as a really effective physical barrier, but it can become a portal of entry when it's compromised through things like cuts, burns, and abrasions, exposing underlying tissues. And some examples here include Staphylococcus aureus and Clostridium tetani. And finally, some infectious agents gain entry through direct access to normally protected tissues, effectively bypassing surface barriers altogether. And this can occur through needle stick injuries, injections, or vector bites from things like mosquitoes, ticks, or fleas. And so pathogens transmitted this way include things like the hepatitis B virus, Plasmodium species that cause malaria, and Borrelia burgdorferi, the causative agent of Lyme disease. And so how do we prevent infectious agents from accessing a portal of entry? Well, many of the control measures we see here should look familiar from our mode of transmission, things like best practice, PPE, good hygiene and decontamination. However, in the context of portals of entry, they are working by blocking access to vulnerable tissues. Even if a pathogen is present in the environment or has been transmitted, these measures will prevent it from entering the body through the respiratory tract, gastrointestinal tract, the urogenital tract, or damaged skin. So at this stage, we're not necessarily interrupting movement between people, but reinforcing the body's natural barriers to stop infection from establishing. And now we arrive at the final link in the chain of infection, the susceptible host. The key point to remember here is that exposure to an infectious agent and even entry into the body does not automatically result in infection. An infectious agent may successfully pass through each of the previous stages, but infection will only occur if the individual that enters is susceptible. Now, host susceptibility is influenced by a range of different factors which determine whether the pathogen is able to establish and cause disease. Now, one of the most important is the host's immune status. Individuals who are immunocompromised, for example those who are old or young, those undergoing chemotherapy, immunosuppressive therapies, or have a HIV infection for instance, they are less able to control or eliminate infectious agents, making them more likely to develop infection and disease. Now, the overall health status also plays a major role. Factors such as underlying health conditions, so things like diabetes, chronic lung disease, cardiovascular disease, or renal disease, can increase susceptibility by impairing normal immune responses or physical barriers. We also have environmental and what we might call occupational factors which can influence susceptibility, not only by weakening immunity directly, but by increasing exposure. And so individuals working in healthcare, laboratory or care settings are more likely to come into contact with infectious agents simply due to the environments in which they work, increasing the likelihood of infection if control measures do fail. And finally, we have vaccination status, which is a critical determinant of host susceptibility. Vaccinated individuals are often protected from infection entirely or may experience mild diseases if infected. And at a population level, high vaccination coverage reduces the number of susceptible hosts, limiting transmission and helping to protect vulnerable individuals through herd immunity. And so together, these factors determine whether an infectious agent can successfully establish infection in a new host. Understanding host susceptibility is essential, not only for managing individual risk, but for designing effective public health and infection control strategies that break the chain of infection at its final link. And so for one final time, how can we break the chain of infection? Well, at this stage, it's all about reducing the likelihood that exposure leads to infection or disease, and so improving health status is a key way to break the chain at this stage. This includes supporting effective immune function through adequate nutrition, hydration, sleep, and management of stress, as well as optimizing control of underlying medical conditions. In a clinical setting, this also involves reducing immunosuppression where possible, monitoring vulnerable individuals closely, and providing additional protective interventions when risk is high. Now, we can do all of those things, but essentially vaccination remains one of the most powerful interventions we have. By priming the host's immune system to recognize and respond rapidly to specific pathogens, vaccines prevent infection entirely or significantly reduce disease severity, lowering both individual risk and population-level transmission. And so at this late stage, the chain is broken not by blocking exposure, but by ensuring the host is resilient enough to resist infection. And so just to summarise, the chain of infection essentially describes the series of events required for an infectious disease to spread, from the infectious agent, through its reservoir, portal of exit, mode of transmission, portal of entry, and finally to a susceptible host. And the key thing to remember in all of this is that infection is not inevitable. There are many opportunities to break the chain at any one of these stages, meaning transmission can be interrupted and disease prevented. And I guess this is why measures such as vaccination, good hygiene, effective decontamination, the use of PPE, and best practice in clinical, community, and food handling settings are so important. Each of these targets a specific link in the chain and reduces the opportunity for infection to spread. And I guess understanding the chain of infection doesn't just explain how diseases spread. It shows us where and how we can intervene, protecting individuals, communities, and healthcare systems. And with that, we come to the end of this video. Hopefully you found the content useful, informative, and most importantly, easy to understand. Thanks for watching, and I hope you have a great day.